Hello and welcome to my channel. That's it. In the previous video we have already discussed about the pharmacology. In this video we will discuss about another term that we have thoroughly or briefly discussed in that video, pharmacodynamics. We discussed the definition of pharmacodynamics. We will discuss about receptors, effectors, sphere receptors, and some other terms that are required to study or to briefly understand the pharmacodynamics. First of all, let's start with receptor. Receptors are molecules present in the biological system for the receptors are the molecules present in the biological system for the sole purpose to interact with the drug. And you can say what does this all of interaction can give? This all interaction can change the biological response or biological system. Only for this sole purpose the receptors are there. Receptors are the molecules that are present inside the human body or the biological system to interact with the drug and to change the biological system. A receptor must be selective to its binding to the ligand. A receptor must be modifiable after its binding to the ligand. A receptor can be a protein or other macromolecule such as enzyme or the DNA, and every receptor has a specific site on it which is known as recognition site. Recognition site has a maximum selectivity and affinity for the drug. You can say that there is a receptor and it's supposed, and this region is some kind of the recognition site which has the maximum selectivity and affinity for the drug to come here and to attach and to change the biological system. So this is all about the receptor part. It indicates what does it mean. It's one thing or the natural component present inside the body to give the effect of what you can say that your drug came, it bind to the receptor. After this binding was accomplished, it's the role of the effector to bring about the change or to bring about the effect to change the biological system. So you can say that effector is a component of the system that accomplishes the biological effect after the receptor is activated. The activation receptor usually comes from the, you can say, from the binding of the drug to the it. So the drug binds to this effect receptor, and the effector is a molecule that after this binding brings about a change. That change is the biological system. Is the greatest effect on agonist that can produce, or you can say that the greatest effect on agonist can produce if the dose is taken to the highest possible level. You take the dose to the highest possible level, and the effect that comes at the highest possible level is known as efficacy. What the more important term is the potency. Potency is the amount of drug that is required to produce the specified effect. Okay, and it is determined by the affinity of the receptors to the drug and the number of the receptors. So this is about potency. KD. KD is the concentration of the drug that is required to achieve 50% maximum binding effect. 50% maximum binding effect on the receptors. Okay. In the same way, EC is same as that KD or the dissolution constant, the amount of drug or the dose of the drug or the concentration of drug required to achieve 50% of the maximal effect. KD deals with the 50% of the receptor side or the 50% of the maximum binding effect on the receptor side, while EC deals with the 50% of the maximum effect that comes after the binding of the drug or the concentration of a particular drug at the receptor. Now, if we compare the 50% of the maximal effect, which is the EC, with KD, which is the 50% of the maximum binding effect, and the KD is greater than the EC, or you can say EC less than KD, then we can say there is a presence of some spare receptors. And spare receptors, from this term we can indicate that receptors that don't bind to the drug. The receptor, ये भी हम पार्ट जितनी साइलेंस है वो भी निकालना. So spare receptors are receptors that don't bind to the drug and don't bring about the effect. So we will discuss about some other terms related to agonists. We have already discussed. ये भी सारा निकालना है सर. इरेज करता हूँ. जितनी भी साइलेंस होना सारी निकाल देंगे. So now we will discuss about antagonist. Antagonist gives the opposite effect of the agonist, or if the agonist is giving a positive effect, then the antagonist has a role to give it the opposite of the positive effect. They are competitive antagonists. The molecule that comes and binds to the receptor side, other than the side to the receptor, you can say competitive antagonist binds to the side other than the receptor and gives the opposite effect of the agonist. But what the main difference is that he can overcome them. How we can overcome them? By increasing the dose or the concentration of the drug. So competitive antagonists come and bind to the side other than the receptor side and gives their negative effect, but we can overcome by increasing the concentration of the drug. Irreversible antagonists cannot be overcome by increasing the concentration of the drug. So if you increase the drug concentration, it will have no effect. Physiological antagonists comes and bind to the another receptor and try to counter the effect of one receptor. So to give an explanation, we can say that there are two receptors, A receptor and B receptor. You can say that this A receptor is causing bronchodilation. From where this receptor came, we can say that epinephrine came, bind to this receptor and started giving bronchodilation. This is the normal functioning of a receptor, but another molecule or came and bind to the B receptor, we started giving bronchoconstriction. So this histamine antagonist tried to overcome the effect of bronchodilation given by the epinephrine by binding to beta receptor, or suppose you can say that another receptor. So a receptor that overcomes, or you can say that histamine is an, ये भी इरेज करना सारा पार्ट जब से मैंने बोला ना एंटागोनिस्ट वहाँ से आगे तक इरेज करना. अब मैं आगे बोलूँगा सही वाला. So you can say that physiological antagonists are the molecules that overcome the effect of another molecule that is giving its effect by binding to another receptor and giving the effect. The same is this case. Chemical antagonists are the antagonists that instead of binding to another receptor, like in physiological receptor, they bind to the drug itself. They try to overcome or counter the effect of already existing drug by binding to itself. Time and dose or the concentration. So there is this graph. Here time is on the x-axis, concentration on the y-axis. There is the term MEC and there is the term MTC. MEC means minimum effective concentration, the concentration or the minimum concentration for a drug that is required to give the effect of a drug. Maximum toxic concentration, the maximum concentration of drug beyond which are the toxic effects of the drug start to come. Between MEC and MTC, there is a region which is known as therapeutic window, or you can say therapeutic index. Usually your drug should remain between this therapeutic window or therapeutic index. It should be more than minimum effective concentration, means its effect should come. It should be less than maximum toxic concentration. So the effect of the drug should usually be like this. It shouldn't go beyond this line. It shouldn't be below this line. It should be between this region, which is the region of therapeutic index or therapeutic window. Total of the 5 signaling mechanism, the number 1 mechanism in which the drug moves from the outside region to the inside region by going a transmembrane diffusion. This is a receptor that is present inside the region, and the drug moves from the outside region to inside region to bind to the receptor and to bring about response. The example is of the steroid. In another example, the whole of the receptor complex is present in the transmembrane region, and it has two regions or two parts. One part is present outside of the cell, another part is present inside of the cell. The outside part, which is present, the outside part of the receptor serves as the binding site of a drug molecule, and the inside part serves as the effector part that brings about a response. This is the second type of receptor, and you can say, for example, tyrosine kinase inhibitors. The third type of receptor is the one the same as the second. The whole of the receptor complex is present at the transmembrane region. The drug comes bind to the outer region, and the inside of the cell there is an cytoplasmic enzyme, JAK kinase enzyme, which brings about the phosphorylation of the STRAT molecule. So you can say that JAK kinase pathway. In the fourth type, the same receptor complex is present at the transmembrane region, but you can say that when the drug molecule comes and binds to it, it serves as a gate. The fourth complex or the fourth receptor type or the fourth signaling mechanism, when the receptor is present in the transmembrane region and a drug comes and binds to it and opens or closes it. When the opens, some of the molecules from outside of the cell moves towards inside, and when it closes, this movement closes. So we can say that it has a ion channel. In the fifth type, which is the GPCR, G protein coupled receptors, the same as that, the whole of the receptor complex is present in the transmembrane region. Drug comes bind to the outer side region, and once the binding is done, the effector part, which is present inside the regions, take a separate effector molecule to bring about the receptor. So this is all about the signaling mechanisms. There are 5 signal mechanisms. All of them have been explained in this video.